Thank you, Devin. And there are several neurological conditions that can affect how you act, and PBA is one that expresses itself in a rather odd manner. So here to tell us a little bit about this condition is Nurse Christina Paris. Thanks for joining me this morning.
Yeah, hi, good morning.
Yeah, good morning. I'm glad you could make it on in bright and early. So PBA, I strategically didn't say the full name. I'm gonna leave that to you. So what is PBA?
It is pseudo-bulbar affect. So pseudo meaning fake or not real. And then affect is our emotions. So we have our mood, that's how we're feeling on the inside. We might be happy, sad, angry. And your affect is what is displayed on the outside. And so it's when things displayed on the outside don't necessarily match what is on the inside. And so people may laugh inappropriately or cry when they're not supposed to. And it has other names too. They call it emotional liability, compulsive laughing or weaking, emotional incontinence.
So it's a very visual thing. So you can definitely tell when someone's experiencing this.
Correct, and it's very common. 50% of people who have had strokes.
Oh wow, 50? Wow,
are affected by this. People who have had traumatic brain injuries, ALS, MS, things like that, any kind of thing that affects the brain. And what it does is it's a disruption of our neurotransmitters. So neurotransmitters are those chemicals that that help spread messages from the nerve cells to our brain so that we react, our body reacts in a certain way.
Right.
And some of the ones that are affected are the serotonin. And the serotonin is the one that's for mood and sleep, digestion, sexual desire. It influences processes such as wound healing, bone health, and clotting. Our neuroepinephrine, now that's your fight or flight neurotransmitter, and it affects mood, energy, alertness, as well as focusing. It also speeds up our heart rate. So if we have to go, it makes our muscles contract, speeds up our heart rate. Then there's dopamine. That's the good one. That's for movement, mood, reward, pleasure, memory, and learning, as well as goal setting. And then glutamate. That's a chemical that helps the message go from from the nerve cell to the brain. And then acetylcholine, which is involved in muscle activation, as well as memory and learning. So in other words, there's a lot of chemicals that could be involved that are disrupting the normal transmission of mood to affect.
Okay. So speaking of all those sort of different neurotransmitters right there, what are some symptoms and causes that might have those going awry?
Yeah, so the symptoms, of course, are going to be, you're going to either laugh inappropriately. So something, you might be at a funeral or something, that should be sad and you're laughing or giggling and it's uncontrollable. You can't help it. Or there might be something funny or going on, but yet you're crying. Or even inappropriate anger can come out too. So might be angry at something that you really shouldn't be angry at. And, again, it's things that have affected the brain, like traumatic brain injuries, strokes, MS.
And during this, you're aware that you're very aware that you should not be laughing.
Right.
Or doing that emotion at the time.
Right.
But you just don't have the control over it.
You don't have the control.
Okay.
And it's very embarrassing for people. And some people, it's even keeping them from going out in public. And it can be misdiagnosed as depression when you're not really depressed. It's just that your emotions aren't matching really what you are feeling on the inside.
Okay. So how do we treat this or manage it when we're trying to go about?
Absolutely. So mainly the big treatment is medication. So there's different medications out there that you can take. Some of them are antidepressants and other medications. Otherwise, there's things you can do, just to try to calm and recenter yourself. If you find that this is happening, you can, take slow, deep breaths, maybe think or focus on things other than the episode that's going on, relaxing your shoulders, your facial muscles, just reducing tension, maybe even changing your body position or posture, and, maybe just even being upfront with friends and family, like, look, this happens to me, and please don't take offense. It's just, this is due to, stroke or whatever you have going on. This is why you're having these emotional outbursts or things that are occurring. So.
Well,
different things you can do.
yeah, there's a lot to be on the lookout for, and just, good communication, and, letting all the parties know, your families and loved ones, and your provider, of course, as well, and just tackling her head on.
Yeah, absolutely. I think we don't talk about it enough with stroke patients, to be on the alert for those type of things coming. People who never cried might cry.
Yeah. And for one more time, what was this called again?
It is pseudo-bulbar affect. You were just testing me.
I
weren't
was
you?
just testing you because I certainly can't say it right. But thank you so much for coming on this morning and talking to us about this. And, we appreciate your time, and hopefully help some folks out there as well. We'll be right back with What's Trending. Stay tuned.